Our next presenter is supposed to be Doctor.com with Dan Daughtery. I don't know if Dan's here. If not, we'll push on. We'll go to our next presentation. That's going to be from Crest, and that's Sarah Scherfer. Was that close enough?
Good morning, everyone. Good morning. Happy Friday. My name is Sarah Scherfer, and as you can see, I work for Crest+Oral-B. One of the coolest things about working for Crest+Oral-B for 13 years is we're always innovating. So that's why I'm here today, is to show you some of the pieces of new news that have recently come out to help elevate patients' home care, especially the ones that are suffering from moderate gingivitis. So let's get started. Ta-da. Okay, so when it comes to mechanical plaque removal, one of the best ways you can help patients is recommend an electric toothbrush. How many of you in this room use an electric toothbrush in your own mouth? Quite a few of you. Wonderful. Well, you'd be surprised to know that the average household concentration in the United States for electric toothbrushes is under 10%. Japan has us beat at 25% household concentration, and Europe has a 25% household concentration as well when it comes to electric toothbrushes. So we've got a little ways to go. But one of the best electric toothbrushes you can recommend to your patients, especially the ones that are suffering from moderate gingivitis, is the OralB Genius. And when you think about the OralB electric toothbrushes, typically you envision round heads, right? Well, we're round for a reason. Round is actually clinically superior. Our brush head was actually inspired by the very tool that you use in your office every day, the Prophy angle. So you can see here, looking at this slide, the type of motion that it makes. It's oscillating, pulsating, rotating. We want to use an instrument that cups the anatomy of the tooth surface, and that's what this offers. You probably wouldn't give a patient a Prophy with a rectangle Prophy angle, would you? No, that doesn't make a lot of sense because like you see in this picture and as you see every day, teeth are round. So you want to use an instrument that caters to the anatomy of the tooth. So that's why it's better. The other neat function that you should know about the OralB electric toothbrushes is, especially in our new one, they move at 55,000 strokes a minute. Your average manual toothbrusher moves their toothbrush at 400 strokes a minute. So if you want to help your patients elevate their home care, lower their plaque scores, get rid of some of their bleeding sites, this is the tool that they should be using in between appointments with you. Okay? So speaking of the electric toothbrush and OralB, we were the first electric toothbrush to be granted the ADA seal. This is a huge honor and something that happened earlier this fall. Getting the ADA seal is no easy feat. It took a long time, but we were the very first ones in getting the ADA seal. Why is that a big deal? Well, for dental professionals, sometimes that's what guides your recommendation, right? A lot of consumers who are also your patients in your chairs, when they're at the store looking for dental products, will look for this very seal, whether they're shopping for a toothpaste, toothbrush, electric toothbrush. So they can purchase with confidence the electric toothbrush from OralB because it's got the ADA seal. Another piece of new innovation that has recently come out, now that we've talked about the electric toothbrush, what are we going to put on it? Toothpaste. Well, this is the brand new Gum Detoxify toothpaste. It's been on retail shelves for just under a month. We introduced it to the profession at the ADA back in October. But what this is designed to do is to help patients that suffer from moderate gingivitis, that have multiple bleeding sites, that have pocketing, because it uses an antimicrobial fluoride called stabilized stannous. It's also got 2 built-in stain inhibitors. What it has the power to do is it uses a unique foaming action that's in this formula. That foaming action carries that stannous ion subgingivally as far down as 4 millimeters. It binds to the endotoxins and helps shrink the tissue up back to a healthier state. So that's what makes this paste so fantastic, is the subgingival claim we can make. Now, flavor is important too, and I know that may sound a little cosmetic to you, but patients won't use something they don't like the taste of. So this actually tastes pretty darn good. And so it doesn't taste medicinal at all, and it helps compliance. The other great thing about this toothpaste is it's got a 12-hour substantivity. So the effects of it are going to keep working for that patient and keep killing that bacteria for 12 full hours even after they're done. When you think about toothpaste, the FDA actually uses monograph to regulate over-the-counter dentifrice. So when you look at this slide, you see a few different categories. You see on the far left all the different indications. In the middle, the different types of fluoride that will treat those indications. And on the far right, the mode of action. When you look down that middle column, stannous fluoride is the only one that is listed to help deal with hypersensitivity, anti-plaque, anti-gingivitis, and anti-caries. So I know sometimes stannous fluoride has gotten a bad rap because folks are worried about the staining, but our stannous fluoride toothpaste actually have built-in stain inhibitors. So that's what makes our stannous fluoride toothpaste so fantastic. So don't be afraid of it. Manual toothbrushes. This toothbrush that you see up here on the screen this year celebrated its 20th birthday. This is the CrossAction toothbrush. This technology was kind of ahead of its time when it launched in '98. It's got 16-degree angled bristles. Angled bristles account for the gaps in between your teeth. So when you're brushing your teeth, it's helping to pull out the plaque in between your teeth. A straight up and down bristle design just brushes right over the gaps. So the CrossAction is actually able to remove more plaque than any other manual brush on the market. So if you can't get a patient to use an electric toothbrush, this is the next best thing. Lastly, I want to share this fun slide with you. At our booth, it's very interactive. If you haven't seen it yet this year, come on by. We've got brushing stations that allow you to try some of these new innovations I just spoke about today. You can try the new OralB Genius. You can try the Detoxify toothpaste. We are giving some of these high dollar samples out to you as you try them out. This also gives you the opportunity to learn a little bit of science behind those products. We are booth 901. We also have a special surprise for you here for attending today. So all of you, most of you, I know some of you came in a little bit after the start time, but most of you got a green ticket. This green ticket, everybody, all the green tickets actually, are going to allow you a very high premium prize at our booth. If you flip your green ticket over and you see a red X, congratulations, you have just won a $180 OralB Genius toothbrush. Yeah. For those of you that don't have an X, don't worry. You also are getting a very premium prize, and that's the Crest HD toothpaste, the two-step toothpaste. That's a $13 retail value. So what we want you to do with these tickets is to bring them with you to booth 901. And we will give you your prize at the booth. And don't forget, we also have the brushing sink, so you can actually try that new Genius electric toothbrush right here on the floor. Thank you for recommending Crest and OralB products to your patients, and we look forward to seeing you at booth 901. Thank you so much.